IV cannulation. Let's start the process of IV cannulation. We are going to perform this procedure using Polysafety ADVA Safety IV Cannula with Quick Flashback ADVA needle technology, which helps in preventing needle stick injury during the procedure. Introduce yourself to the patient and do the required verifications. Explain the need for the procedure and gain consent from the patient. Following items required for the procedure: 70% alcohol plus 2% chlorhexidine based hand rub, clean pair of gloves, tourniquet, alcohol swab, appropriate size of IV cannula according to prescribed therapy, needle-free connector, pre-filled saline syringe, transparent semi-permeable IV dressing, steel tray. We will start with performing hand hygiene. Wear a clean pair of gloves. You should select a site that is the least restrictive for the patient, such as the posterior forearm or dorsum of the hand. Select the venous site most likely to last the full length of the prescribed therapy. Avoid veins in the areas of flexion, pain on palpation, in the proximity of compromised skin or other compromised veins, for example, previously cannulated, bruised, etc. You may also use vascular visualization technology to identify the veins. Apply tourniquet to help locate and define veins to achieve successful and safe venipuncture. Clean the site with circular motion from inside to outside using an alcohol swab for 15 to 20 seconds and allow the site to dry. It is very important to allow the site to dry, as it helps in reducing pain to the patient while inserting the cannula. Before venipuncture, warn the patient for sharp prick. Perform venipuncture. You may see the instant flashback in the catheter as we are using cannula. ADVA needle technology or quick flashback technology helps in early identification of veins, reducing the chances of multiple pricks. Always select the smallest gauge IV cannula that can accommodate the prescribed therapy and patient need. Apply gentle pressure with the left hand index finger above the cannula tip and release tourniquet with other hand. Remove the needle. It comes out with a sleek and light-weighted needle safety guard, fully encapsulating the needle bevel, ruling out the chances of accidental needle stick injury. Discard the needle in the sharps bin. Stabilize the cannula with the dressing and label it with today's date. Scrub the hub of the connector extension line with an alcohol swab and let it dry. Perform flushing using the pre-filled saline syringe in the push-pause manner. Discard the used articles according to the waste management protocols. Thank the patient for the cooperation. Do the necessary documentation after IV cannulation insertion. To keep this IV cannula safe, you may give the following tips to the patient. 1. Don't move the cannulated arm too much. 2. Keep the cannula side clean and dry. 3. Avoid pulling or putting pressure on the cannula. 4. Not to disconnect or pull on the cannula on your own. 5. If any redness, pain, swelling, then inform the nurse.